Hello, this is Dr. David Greene, CEO of the Texas Pain Network. Today's topic is an overview of failed back surgery syndrome. Failed back surgery is when the outcome of low back surgery fails to produce the desired outcome. The result ends up in chronic pain. It's termed failed back surgery syndrome. It is one of the most frustrating things a patient can deal with since they actually went through surgery hoping for a pain-free outcome and it just didn't happen. Studies showed that up to 40% of all back surgeries fail. 10% of back surgery patients actually end up worse than before, and each additional surgery performed has a lower chance of success than the previous. It can be exceptionally depressing. Why does it occur? Well, there are several reasons. The first may be that surgery was performed for the wrong reason. Even the best board-certified, fellowship-trained spine doctors, been in practice forever, they still get it wrong 50% of the time as to why a person's back hurts. It's just a sad fact of modern medicine that it hasn't really produced groundbreaking knowledge about back pain. Now, surgery could also be performed for the right reason, but the person just is left with residual pain. So you could do a technically perfect surgery and it just didn't work, or it only worked a little bit. Another reason it might be that the surgery was inadequately performed. Could be that fusion just didn't happen. You fused a few levels and then the hardware breaks because it continues to see all this load because the fusion didn't happen. And also it could be that the outcome was satisfactory initially, but then scar tissue might form around some nerve roots. The hardware itself could become painful. You may get this adjacent segment degeneration above or below the fusion, things like that. So here's an example of adjacent segment degeneration. You have a two-level fusion here, and the hardware is still intact. But look at the level above. There's no disc space left, and there's actually auto-fused pretty much. There's bone coming over between the two levels. And you have no disc. So it really did degenerate, and it may or may not be exceptionally painful. The symptoms of failed back include daily back pain. It may radiate out right and left, muscle spasms and aching, and often leg pain and burning due to either sciatica from possibly spinal stenosis. Treatment options include a surgical evaluation just to see if a revision would actually help. If there's broken hardware, it may be because a fusion didn't occur, or there could be a fracture above or below, or it could be so bad, adjacent segment disease, that surgery is indicated. Anyway, that should happen. Physical therapy and chiropractic treatment may help. Spinal decompression therapy has been shown to be very helpful, but if hardware is in place with the fusion, it's contraindicated. Acupuncture, medications may include oral or topical. The medications that may be selected may include narcotic medication, muscle relaxers. There are some medications called Neurontin and Lyrica that can help a lot with nerve type of pain. And then topical medications may include numbing like lidocaine or anti-inflammatories as well. When it comes to interventional procedures, trigger point injections may help with the muscle spasms and aching. Hardware injections, if the concern is that the hardware is causing pain, then you can inject numbing medicine around it and see if the pain is relieved. Facet blocks or medial branch blocks are injections around facet joints that may be causing pain. Okay, so the injections serve two purposes. Diagnostic, because if they provide pain relief, then you can say, aha, that's where the pain's coming from. And then therapeutic, those injections can provide pain relief for 3 months. Radiofrequency ablation is when the catheter here goes around the joints and applies thermal energy to deaden these little nerve endings, and that can provide pain relief to up to 18 months. Okay, and then if a person's having sciatica nerve pain, then epidural injections can be helpful as well. As a very last resort, if nothing else has worked and surgery is not an answer, a spinal cord stimulator implant has been a revolutionary treatment for failed back surgery syndrome. They've dramatically improved over the past decade. They're now good for both back and leg pain, with over 200 programming options available. Over 75% of patients do extremely well with spinal cord stimulator implants. And, it's a proverbial Band-Aid because it doesn't fix the problem, but if the problem can't be fixed, you might as well mask it And that's why this is such a great procedure, because there's no other options available. The top non-operative pain management for failed back surgery syndrome and all other pain conditions is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average success rates overall exceed 90% with the board-certified, award-winning pain doctors. Visit us online today at texaspainnetwork.net and then call us at 877-877-8556. I'm Dr. David Greene with the Texas Pain Network. Your pain stops here.